The physician may ask the medical assistant to apply cold to treat a variety of conditions including bruises, minor burns, sprains, strains, joint injuries, or fractures. The physician may also want the medical assistant to teach the patient how to apply cold at home. Cold can reduce bleeding, swelling, and pain. It can also inhibit the early stages of an infection, which reduces inflammation. When cold is applied locally to a body part, the blood vessels in that area constrict, meaning they decrease in diameter. This causes the skin to become cool and pale. Cold applications should always be placed in a protective covering because applying cold directly to the skin can result in a skin burn. Apply cold for the recommended amount of time only. Apply cold with caution and only for the time specified by the physician. Prolonged application of cold for more than 1 hour can have a reverse secondary effect. Always take the individual patient into consideration. Based on certain factors, people respond differently to cold, so the temperature may need to be adjusted. Sanitize your hands before proceeding. Assemble your equipment, which includes the ice bag with the protective covering and small pieces of ice. Either ice chips or crushed ice will work. Greet your patient and introduce yourself. Identify the patient and explain the procedure. Joanna has just injured her left wrist. The physician has asked the medical assistant to apply an ice bag for 20 minutes to relieve pain and reduce swelling. The medical assistant must also instruct Joanna in the procedure for applying an ice bag at home. Make sure to check the ice bag for leaks. A leaking bag will get the patient wet and cause chilling. Next, fill the bag 1/2 to 2/3 full with small pieces of ice, such as ice chips or crushed ice. Smaller pieces reduce the air spaces in the bag, resulting in better conduction of cold. In addition, smaller pieces allow the bag to mold better to the body. Expel air from the bag by squeezing the empty top half and screwing on the stopper. Air in the bag interferes with the conduction of cold and makes it difficult to mold the bag to the body. Place the bag in a protective covering. The protective covering is more comfortable and absorbs any moisture that condenses on the outside of the bag. Place the bag on the patient's affected body area. Make sure to ask the patient how the temperature feels, because individuals vary in their ability to tolerate cold. The application of ice is usually uncomfortable, but most patients accept it if they realize the benefits they can derive from it. Check the patient's skin periodically for signs of an increase or decrease in redness or swelling. Administer the treatment for the proper length of time as designated by the physician. Be sure to ask the patient whether the site is painful. If extreme paleness or numbness or a mottled blue appearance is noted, remove the bag and notify the physician. Sanitize your hands. Review the instruction with the patient for applying the ice bag at home. Check to make sure the patient understands how to do this. Provide the patient with written instructions to take home. Ask the patient to sign the instruction sheet and witness her signature. Sign the instruction sheet with your name and date. Chart the procedure. Include the date and time, the method of cold application, in this case it is an ice bag, the location and duration of the application, the appearance of the application site, and the patient's reaction. Also chart the verbal and written instructions you provided to the patient for applying an ice bag at home. Make a copy of the instruction sheet to give to the patient. File the original in the patient's chart.